because this is also part of our concern, and that was why we were excited. When the REAN Foundation approached me, and I told them that we are not going to rule out anything unless we do some feasibility studies here in Nigeria. So we started off with feasibility study. We are going to take it further with even randomized control trial that will be done with patients from here. And the opportunities are there. And for us, what we want to do is to call on even countries that are higher, developed countries, to know that the manpower to do the trials are here in low and middle income countries. And that was why I was emphasizing use of simple technologies that have been there over the years. I keep telling people that there is no hospital, no matter how small, that doesn't have an ECG, for example. So you discover that if we concentrate on how do we maximize the research, get the patients, who have done, expose them to the ECG and all that. How do we maximize the information we get from blood pressure of patients who are in Africa, for example, and not patterns that are developed from patients elsewhere? And the only thing we can do that is to do the research with patients in Africa. When we were trying one of the first anti-hypertensive drug trials that was done in the whole of Black Africa, multi-country trial, one of our arguments is that we need to look at Africans who are born and living in Africa. I always tell my colleagues in the US that Black Americans are not the same thing as Africans. That Africans who are born and living in Africa are completely different in all ramifications. So summarily, I quite agree with the person who asked the question, and that is why all we are doing is to generate data, even train our machine. As I was speaking with the young man I told you who tried the Healthy Heart Assistant in Abakaliki, I told him that we need to generate the data we are going to use to train the machine, the machine learning. And that if we generate the data within us here, we are going to learn a lot. I'm also going to say that for us in Nigerian Cardiac Society, one of the things we have also done, knowing the rate at which this is moving, is to really create the digital health as a component of what, a working group, so to say. In the last conference we just held in Port Harcourt, we gave a space for, papers that are AI. And I'm happy to say that the Healthy Heart Assistant, the paper on Healthy Heart Assistant won the best abstract in Nigeria here. So we are quite excited. And one of the first things we are going to do within the next 1 year is to have a working group, really, in Nigerian Cardiac Society that will look at this and probably liaise with more advanced people like our colleague in American Heart Association on the best way to be sure that data generated that we are used to train the machine are locally generated. Thank you very much.